Good afternoon, folks. This afternoon's topic A is a discussion about heat stroke and the vulnerable people in society that it affects. Okay, so I'm going to go through that for you for A. So please join me in discussion A, heat stroke for vulnerable folks. Give me a minute to set up and we will get going on the first one today. So, give me a couple seconds. All right. So here, a summary of the main points. Title of the article, How Heat Stroke Affects Your Body. What is heat stroke? Heat stroke is a severe medical emergency where body temperature rises to 104 or higher. It occurs when the body's internal cooling system fails, even with sweating. If untreated, it can lead to brain damage or organ failure or seizure and death. Symptoms: rapid onset of symptoms such as headaches, dizziness, nausea, confusion, unconsciousness. Okay, who's at risk? Older adults, children, and people with chronic medical conditions. Prevention tips: stay indoors during extreme heats. Stay hydrated. Take frequent breaks if outdoors. Follow guidelines from the from Centers for Disease Control Prevention, CDC. Would you like to would you like a deeper dive into how heat stroke affects specific organs or systems in the body, or maybe a comparison with heat exhaustion? Source: MSN Health. How heat stroke affects your body. Heat exhaustion and heat stroke can both have lingering effects, but the long term consequences differ in severity and scope. Heat exhaustion, long term effects. Most people recover fully, but some may experience residual fatigue lasting days to weeks. Reduced heat tolerance, especially during future heat exposure. Increased sensitivity to dehydration or exhaustion in hot environments. Cognitive fog or malaise in rare cases. especially if dehydration was severe. These effects are usually temporary and improve with rest, hydration, and avoiding heat stress. Heat stroke long-term effects. Heat stroke can cause permanent damage due to its impact on vital organs and the central nervous system, neurological and cognitive, memory loss, confusion, or long-term cognitive impairment, increased risk of epilepsy, delirium, or motor dysfunction. Psychological changes such as mood, uh, instability, cardiovascular, and renal, chronic heart disease, including arrhythmias and heart failure, kidney damage or chronic kidney disease, increased risk of fatal organ failure years after the incident. Okay, epigenetic and immune changes, epigenetic alterations, cellular memory that affect how cells respond to future stress, long-term immune system dysregulation, making the body more vulnerable to illness, metabolic and muscle injury, injury, metabolic disturbances, and oxidative stress, reduced resilience to environmental stressors. Prevention and recovery. Early intervention is key to minimize long-term damage. Cooling within 60 minutes of onset improves outcomes dramatically. Follow-up care may include neurological assessment, kidney function tests, and cardiovascular monitoring. Would you like a breakdown of post-heat stroke rehabilitation strategies, or how to design heat illness protocols for vulnerable populations? Effective rehabilitation after heat stroke requires a multifaceted approach that prioritizes physical recovery, neurological monitoring, and prevention of reoccurrence. Here's a breakdown of the most recommended strategies. Immediate post stabilization care. Once the person is medically stabilized, rest is essential. Avoid strenuous activity for several days. Hydration. Maintain fluid intake with electrolyte-rich drinks. Okay. Cool environment. Stay in air-conditioned or shaded areas to prevent read exposure. Neurological and cognitive monitoring. Cognitive assessments. Track memory, attention, and mood changes. Psychological support. Address anxiety or trauma related to the event. Sleep hygiene. Support brain recovery through restorative sleep. Gradual return to activity protocol. Athletic trainers and rehab specialists recommend thermo neural exercise. Start with stationary cycling or elliptical in air conditioned settings. Low impact movement, rowing or gentle walking to rebuild endurance. Progressive intensity, increase activity slowly, monitoring signs of overheating. Heat rate monitoring, keep exertion within safe physiological limits. Nutritional support, whole foods, emphasize fruits and vegetables, and lean proteins. Electrolyte balance, coconut water, sports drinks, or oral rehydration solutions. Anti-inflammatory nutrients, omega-3s, turmeric, and magnesium-rich foods to support cellular recovery. Environmental and lifestyle adjustments. Okay, folks, give me a minute to get this done for you. Avoid heat exposure. Wear light-colored clothing and schedule activities during cooler hours. Smart housing. Use fans, cooling systems, and temperature alerts. Behavioral strategies. Educate on early warning signs and self-regulation techniques. Long-term follow-up. Kidney and liver function tests, cardiovascular assessment, and neuropsychological evaluation for persistent symptoms. Would you like help designing personalized post-heat stroke recovery protocol for older adults or individuals with frailty? I can tailor it to specific vulnerabilities and care settings to reduce the risk of heat stroke, especially exhaustion. Here are the most effective preventative strategies drawn from leading health sources like Mayo Clinic or GoodRx and MedStar Health. Core prevention strategies: stay hydrated, drink water regularly even if you are not thirsty, include electrolyte-rich fluids, sports drinks during prolonged activity, avoid alcohol and caffeine, which can dehydrate you. Okay. Dress for heat. Wear loose-fitting, light-colored, breathable clothing. Use wide-brimmed hats and UV protective sunglasses. Apply broad spectrum sunscreen SPF 30 plus and reapply every 2 hours. Avoid peak heat hours. Schedule outdoor activities during early morning or evening. Rest frequently in shaded or air-conditioned areas. Accumulate gradually. Allow your body to adjust to heat over several days. Increase indoor activity intensity slowly. Know your medications. Some medications, e.g. diuretics, antihistamines, beta blockers, impair heat regulation. Consult your healthcare provider about heat sensitivity risks. Use the buddy system. Check on vulnerable individuals, older adults, children, outdoor workers. Never leave anyone in a parked car, even briefly. Listen to your body. Early signs like dizziness, nausea, or excessive sweating signal heat exhaustion. Stop activity and cool down immediately if symptoms appear. Okay, guys. So I'm going to take a break for now and go get something to eat. I'll be back on later for shows. For now, Gator Wellness. Take care, folks.